Only a handful of NEHAWU members sustained the energy of picketing outside the entrance of Charlotte Maxeke Academic Hospital today. Health Minister Dr Joe Phaahla told of the impact the strike has had so far, even on lives.
We're still doing a reconciliation in the province and nationally in terms of the number of people, but as of this morning, preliminarily, I'm afraid to go into a lot of detail. There was an indication that up to a number of 4 people, are likely to have lost their lives in a manner which can be attributed directly to the strike. We have a legal team which we are consulting to look at what are our options in that regard.
In response to this, NEHAWU says the blame should be directed to the employer.
As workers, obviously it will touch us because before we become workers, we are community members. We are part of these communities that we are saving. But that particular blame must be put back to the employer because the employer did the right things. From 2020, the very same employer that is playing holy today have reneged from the resolution 1 of 2018 in 2020. In 2021, the very same employer offered what we call gratuity. We kept quiet. The same employer last year forced through our throat 3% that we never agreed it on. So if the employer could have done things differently in the right platform, in the collective bargaining, I don't think South Africa will be facing the situation that we are.
The CEO of Charlotte Maxeke Academic Hospital detailed the impact that the strike has had at the facility.
We had mothers who had to deliver. Unfortunately, as it was said, when you work in theatre, you do not need a nurse and a doctor only. You need the operators who must wash the instruments and all other things, the porters to move the patients. I must say that our clinical team who managed to come in became cleaners, they became everything to ensure that at least the emergencies that were there, the mothers who had to deliver managed to deliver through that. However, the elective cases, I'm told it was 61 of them had to be cancelled. And the 4 emergency theatres to try and deal with whoever was already inside in terms of this. So all the emergency scissors elective scissors will have to be rescheduled and put somewhere else. And those patients had to be discharged home because we can't keep them when we didn't know how long it was going to take. We ran 33 theatres, as I say, and so the emergency theatres, with the staff that we had, we could only run 2. I think at night they tried to open the 3rd one. I think it worked towards the early hours of the morning where they managed to do some of the trauma cases that were in casualty. In terms of the outpatients, we normally see about 1,800 patients in the hospital, of which 1,200 come to about 52 clinics. We saw about 10, if not 15%. The difficulty we had was that these patients were allowed in, but the clerks who must register them and pull their files were not allowed in. And I'm going to what the minister said, is the clerk an essential service? Even if the doctor is here, if he doesn't have the file or the nurse does not have the file, there is absolutely nothing they can do.
There's still no details about the meeting between the employer and the union that was held earlier today, but NEHAWU members say they will keep on striking until their demands are met. Diabosito, SABC News, Johannesburg.